Good afternoon, everyone. Global Integral Beauty Networking 2024. This is our second networking from 2024. Today, we're going to talk a little bit about hair restoration treatment. For everyone who don't know me, my name is Idalis Bailey, with more 18 years experience in the health, wellness, and aesthetic industry. I'm a registered nurse with MBA in marketing, skincare expert in global integral beauty, New York State licensed medical esthetician also, author bestseller from the 2 books from a global expert in integral beauty. And the third one is coming and it's going to be launched in the Mario Marquez conference on October. From their experience, for their expertise, what they can do with that kind of patient like that.
Yes. I'll go first. So this is very interesting that this gentleman, likely in his 30s, with his type of hair loss. And I'll start with just some of the underlying causes of the types of hair loss that come into the practice, especially with the presentation of this gentleman. We have a genetic predisposition to hair loss and hair thinning within the crown of the head, which is in these regions. There's also the hormonal aspect, both male and women, but more commonly women, and that is attributed to the female pattern hair loss or baldness, and then underlying health conditions or stress-related issues that can present with more patches rather than a loss of hair within the frontal crown and the back of the crown. On a personal note, 1 year and a few months, I had exactly the same thing happening. And with my presentation, I'm a perfectionist with my patients, but also with myself as well. And so I traveled out of the US and had my hair restoration done, where I replaced hair on front and a little bit in the hairline itself. And as you can see, one year, few months after, it's just full hair with no hesitation for me to refer patients. In my case, this was androgenic hair loss or androgenic alopecia, which is hereditary. There's also the autoimmune alopecia areata, where individuals may have a medical condition that the body is attacking the hair cells, causing hair loss in particular patterns as well. Telogen effluvium, this is more from physical stress, emotional stress. These stresses that can most likely cause hair thinning. So many times when I'm discussing with my patients or with this gentleman that we're looking here is I don't necessarily want to see how much hair loss they have, but I want to hear how much hair they're finding on their pillowcase or how much hair they're sticking to the bathroom wall each and every day.
And hair restoration treatments aim to restore a full head of hair, allowing this young man to hopefully regain his confidence. Improve the appearance. Our goal is to have the hair loss improve the area. For him, he has this M shape, which lets us know it's probably more a hormonal component of why he lost his hair. Enhance his self-image. A full head of hair can greatly enhance a person's self-image and how they perceive themselves. Hair restoration treatments with this young gentleman could possibly help him have a more positive outlook on life, and most importantly, provide a long-lasting result. We are trying to figure out why this is happening. Is it genetic? Is it lifestyle? Is it nutrition? Is it metabolism? All those factors can contribute to a person having hair loss, especially this young man. He probably has a demanding lifestyle and stress, and maybe a genetic component. The fact that we can see this M shape going on, which we do know that testosterone is converted to DHT, which causes hair thinning and hair loss. So did he try other medications at some point in time? These are questions I want to ask my patients when they come in. Did you reach out to your dermatologist? Did you try cortisone shots first? Did you try any medications? Did we get blood work? What else could be going on? Did we look at your thyroid levels? Did we look at some vitamin deficiencies? Or just is this a genetic component? So I look at the entire scope, but also taking in mind that this patient, by the time they get to me, they might have tried these and they're hopeless. their confidence is down. They're to a point where they're looking for some help in some way. And these treatments are great. The doctor did a great job by displaying so many different treatments that a lot of patients can have, but it does take work. It's going to take time, and you're going to need to also change your lifestyle when you're doing these hair restoration treatments in general.
Thank you, Yolanda. I have another question for Dr. Clark. What role do you see for non-surgical interventions, such as you was talking about the PRP, the therapy with microneedling, but I would like to know if you have a special protocol for this, or how you can recommend for the other professional to work that combination, the PRP with microneedling. You say that the result is better when you do both, no?
So basically, once the patient comes in, we have you must have at least a minimum of a 10 to 15 minute conversation with the patient, which encompasses everything that you just mentioned, the psychological and emotional effects of the patient toward the condition, but most importantly, finding out when it started and what they have done prior. Many times it's the first time they're having something done with us. My protocol is to always start with the most minimal treatment at all, which is going to be the cortisone injections. Sometimes patients may not have access to blood work, or they just may not be able to get that blood work and get back to you and have things done. So it's very difficult dealing sometimes with the public in general, especially if you're not doing the blood work in-house. My rationale for that is that most patients, many times, regardless of the reasons why they have the hair loss, there's only a few treatments that are actually going to work, and the first is going to be the cortisone injections and the ketoconazole shampoo. After that, then I have to monitor on a daily basis how much hair is coming off in the pillowcase. So with that, they would take a Ziploc bag, and every day they take a shower, they would put the amount of hair in the Ziploc bag and label that bag, or take a picture of that bag, so we can monitor the reduction of the hair. Once that occurs, if they're coming back to me and they're having some improvement, then I would prescribe them or give them a topical either progesterone for the females, progesterone oil that they can use in the scalp that helps revitalize the hair follicles, that they will use approximately for 1 to 2 months. Once that is finished, now we want to get into the PRP, which is the next step above. I do like the idea of LED light therapy, laser. It does work. It does help calm the scalp down, but it has to do with the dosage of LED.
What is the next or technology that you believe that who is going to better?
We believe in the PRP. I'm with the doctor on it in general. I make sure my patients are prepped prior to even coming in to get their treatment. They need to prepare their body. They need to prepare their scalp. Come in, if you have a system on your head, make sure you don't come in with all these things, and make sure you're hydrated, because we do have to draw your blood. Those growth factor cells are as good as what's in your body. So if you don't have a healthy body, sometimes you're not going to get the best results. So this goes back to nutrition again for the patient. So I've seen great results with PRP in my particular practice with patients. I personally have, I'm a partner with Nutrafol. I like more natural options as well, just due to less side effects than trying to prescribe some of the other medications. I'm seeing about 30% more hair growth when adding the PRP with the Nutrafol. I also have incorporated the low LED light therapy. We do know that that's going to help with some inflammation on the scalp, as well as help regrow those cells. But making sure the patients leave out with something, because this treatment doesn't just stop here in the office. Yes, you're going to follow up in 4 weeks. This treatment, it's a process. I tell patients it's a process, and it might be slow. It's not going to be fast. Give your body time. We know the hair growth cycle is 3 to 6 months. So you have to give your body time, and some patients will need multiple treatments to achieve the results, and they might need maintenance therapy, twice a year. So for me personally, I make sure they go out with something that's going to help with longevity of the hair growth. I add the Nutrafol. We look at now shampoos that would probably be beneficial for the patients as well. So for me, I really am key on the PRP because it's natural. I've seen it work with my patients. If they qualify for it and they're doing really well on it, I've seen great results in the long run. Thank you again. I truly am just honored and grateful to have been asked to be a speaker today. Also, what you're doing, I think, is great work by having more injectors and doctors and NPs and PAs and estheticians be a part of this beauty networking event that you do, and you hold it online, and we're able to reach so many people. And the whole purpose of this is to educate, let people come to a safe space where they can talk about beauty, hair restoration treatments, and all things in that genre. So thank you so much. And I'm grateful that you asked me to come today. And this has been a pleasure, and I totally enjoyed it. So thank you.
So this is, I believe, the second time I'm here with you, Dallas, via Zoom. And I have to say, it's growing in leaps and bounds. I am so honored that you have taken me on to be a part of this wonderful journey. 100%, it takes a lot of guts and confidence and know-how, but that's exactly what I saw in you many years ago. And, we truly see this in individuals as we move forward in life, and we see that even though things can be very difficult at times, we're still dredging on through. And with aesthetic medicine, that's what we need. We as injectors, we are the forefront of this medical specialty, and there's no one behind us. There's no one to go back 50 years behind us. We are the ones that 50 years from now, they're going to be looking at our work. So I love it. It's beautiful content. It's only going to grow, and if I can be a part of it to give so much more content and information on my personal experiences. I am very big on anecdotal information. I do use studies and articles as a reference only, but most of it is going to be anecdotal information coming from your patients in the spa. And for that, this platform has given me the ability to speak about my personal experiences and why a treatment is good, or in my opinion, is not a great choice, especially for injectors moving forward. So thank you for this platform, Dallas.